Bonjour, Tensei. Good afternoon. My name is Nathalie Kermoal. I'm a professor in the Faculty of Native Studies, as well as the director of the Rupertsland Center for Métis Research. So I would like to welcome all of you to the live stream format of the Spring 2021 Métis Talks. And would like first to acknowledge that the University of Alberta is located on Treaty 6 territory, traditional gathering place for Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. So for those of you who don't know what the Rupertsland Center for Métis Research is, it's actually a joint venture between the Métis Nation of Alberta, the Rupertsland Institute for Métis Excellence, the Faculty of Native Studies, and the University of Alberta. We are housed in the Faculty of Native Studies, and we are also an academic research program specifically geared towards Métis issues. And in May 2021, we will be celebrating our 10-year anniversary, so stay tuned. The goals and objectives of the Research Center include building provincial and national connections with the Métis community, increasing research capacity to advance Métis-specific research, and training and employing student researchers. So Métis Talks are a semi-annual public event in the fall and in the spring that highlights Métis-specific research, art, and culture. Raegan Bartel earned her Master of Public Health and Bachelor of Science in Nursing from the University of Alberta. She has 16 years of critical care nursing experience delivering frontline care in an Edmonton ICU before moving into population health as the Director of Health for the Métis Nation of Alberta. She's a daughter, granddaughter, wife, and auntie. She is a proud Métis woman, descending from the line of Ignace Poitras Sr. on her father's side and Irish settlers on her mother's side. Her focus is on ensuring that the Métis stories, experiences, and perceptions gifted to the MNA are incorporated into health advocacy, policy, programs, and services. She values leadership, culture, community, growth, and transparency in her life and work. Dr. Maria Ospina is an assistant professor with the Department of Obstetrics and Gynecology, a clinical epidemiologist, and population health researcher. She is a Canada Research Chair in Life Course, Social Environments and Health, and member of the Women and Children's Health Research Institute. Dr. Ospina's program of research involves epidemiological studies and mixed method approaches to examine early life influences on long-term health and the role of social and environmental determinants on maternal, perinatal, and child health outcomes. So today, their presentation title is Misi, Yehewin, which means big breath, understanding COVID-19 experiences among Métis in Alberta.
Thank you very much for that kind introduction. So I'm just going to turn my camera on, making sure that everybody can hear me, and I'm going to screen share here and we'll get going. So bear with me as I get this up and running. And I will just look to Dr. Ospina. Maria, give me a thumbs up if you can see. Perfect. Okay, well, thank you for that introduction, and it's such a pleasure to be here. For those of you that are dialing in and perhaps can't see the screen properly, my name is Raegan, and the other lovely lady that you can see now is Dr. Maria Ospina. So we won't take too long on introduction since we've already gone there. So today, I think what we hope to accomplish is to provide a presentation that is grounded in the experiences of Métis Albertans, especially their experiences during what seems like a never-ending pandemic. So we're going to set the stage by providing a little bit of a brief overview of the impact that COVID has had on citizens of the Métis Nation of Alberta before we move into sharing a very preliminary look at what community has so graciously shared with us. And we're going to conclude the presentation with a discussion of future directions related to this piece of work. Before we dive into the presentation, I really want to sincerely thank the more than 1,500 Métis Albertans who took the time and shared their experiences of the pandemic with us. Merci for sharing your knowledge. We're so grateful. I'd also like to take a moment to acknowledge the team that worked to develop, validate, and analyze and continues to analyze this really comprehensive survey. Genuine partnerships are really hard to come by, and this one truly is that. So thank you to Dr. Ospina, Dr. Coleman, Sana, and Ashton for your amazing work on this project. We're just kind of beginning, and this is an opportunity for us to give community a little bit of a report back. So thank you to you and to community. And just to acknowledge that this survey itself was funded by the Public Health Agency of Canada. So I am not here today to provide a history lesson about the Métis. There are definitely very many places to go to gain this information and have that better understanding of Métis history and culture. And I do encourage all of you who are attending or watching after the fact to seek out those places and spaces that offer those lessons. What I do feel, however, is important prior to presenting our preliminary findings is that I think it's really critical to understand that when we speak of Métis people, we honor the fact that the Métis are incredibly strong and resilient people. They're one of 3 distinct Indigenous peoples of Canada. And yes, their culture originated from the Union of European Fur Traders and First Nations women in the 1700s. And descendants of those marriages did form a distinct culture, collective consciousness, and nationhood in the Northwest. And, there is a common misconception that, any intermingling of Caucasian and First Nations people create Métis offspring, and that is not the case. Métis people did have a distinct homeland, and it was in this homeland that our unique culture, laws, language, and traditions were born. And this misconception, which is rather common, does lead to unique challenges and traumas for Métis people. Many of the past and present challenges of the Métis can, be linked to the erasure and invisibility of Métis history and identity. Métis experiences of colonization have created and maintained many of the same traumas as some of our First Nations and Inuit peoples. And it's important to know that Métis folks were also dispossessed of their land and their culture through colonization. You can certainly visit Rupert's Land Center for Métis Research to learn more about that through their script, pamphlet, and conference that they had. So why this brief history lesson? I think that despite the ongoing horrors of colonization, the Métis are a strong, proud, and resilient people. And I think it's really important in times like these where a pandemic has the potential to create different narratives, that we remember that while this presentation may uncover or present challenges that Métis people face, that is not indicative of, or nor does it define who the Métis people are as a people. So I want to set that stage before we move forward. So for anyone who has taken an interest in the pandemic, you may have seen these dashboards. They're created with aggregate data, so grouped data that is publicly available on the Government of Alberta COVID website. but you will not have seen this particular dashboard. This is a quick overview of the impact that COVID-19 has had on M&A citizens. So through our information sharing agreement, we receive de-identified aggregate reports of the impact that the disease has had on our registered citizens. So within our community, we have roughly 2,200 active cases of COVID-19 as of April 14th. That is approximately 3% of our community that has been impacted by COVID. And sadly, 12 families are mourning the loss of somebody related to COVID-19. And we know that through, kinship and community ties, that those 12 deaths actually impact a lot more than 12 families. We are not immune as Métis from this disease. Also, I'd just like to highlight the gray box for folks that are watching, because from this chart, you can see that 36% of the cases that we have within the Métis Nation of Alberta are unknown exposures. And so this means that public health professionals don't really know where the person came into contact and will have a challenging time trying to halt that transmission. So this, again, is updated as of April 14th. We receive these reports every few weeks. And I think it's important to note that the trajectory, again, indicates that the Métis Nation is well within phase 3 or wave 3 of the COVID-19 pandemic, because in the past 2 weeks, we've seen cases go up by approximately 250 in the last 2 weeks. So we're definitely headed in the wrong direction. But this information, combined with the fact that there's a paucity or absence of information on Métis experience with almost anything health related, and certainly related to this pandemic, and then hearing from community members who wanted to have a deeper understanding of what was going on in their community, and wanted to ensure that their missing stories were actually present to inform the development of policies or programs or services. That's the triangulation that we needed to do this work. I also want to acknowledge that this work was completed and developed in accordance with the 6 principles of ethical Métis research, which were outlined by the Métis Center of the National Aboriginal Health Organization, which I know is no longer active, but this is still a really great way to center our work and ensure that the processes that we are taking respect community, acknowledge community, and are for the benefit of community. So I think it's just really important to highlight, and I'll turn it over to Maria to get into what our study was all about and some of the preliminary results.
Okay, my internet connection is a little bit unstable, but I hope you can hear me. Can you hear me, Raegan?
Yes.
Okay, so we expect that Misi Yehewin will provide evidence of Métis physical and mental health and well-being during the pandemic, and gather information about Métis perspectives and experiences during the COVID-19 pandemic and regarding the public health orders that were implemented in Alberta. So exploring the experiences of Métis people with the COVID-19 pandemic in Alberta helped to understand better how socially produced physical and mental health inequities might be exacerbated during pandemics, as we have seen in this pandemic. And this information is going to be very useful to inform future responses to tackle these inequities that might potentially affect Métis people. And it's also important to highlight that the scope of this work is to understand how the knowledge generated from this research can also inform similar Métis initiatives to improve the physical and mental health and well-being during pandemics in other jurisdictions in Canada. So this is the first study to provide a comprehensive evaluation of health and well-being outcomes of Métis people during the COVID-19 pandemics. And in the next few slides, I'm going to present you a little bit of a summary of the methods for the survey. So we had two main objectives for this survey. One was to evaluate the longitudinal trajectories of physical, mental health, and well-being of Métis in Alberta during the COVID-19 pandemic at different points during the pandemic, and take a closer look to the influence of social determinants on these longitudinal trajectories and on how mental and physical health and well-being have evolved throughout the pandemic. And a second objective was to explore Métis perspectives about the impact of the COVID-19 and their experiences dealing with the pandemic, and also how, what has been the impact of the public health orders that have been implemented in Alberta over the pandemic. So in the next slide, I'm going to describe a little bit the methods of our work. So we planned a longitudinal online survey that has 3 data collection waves. So the first wave is the baseline survey that was conducted between December 18, 2020 to January 31st, 21. Wave 2 is currently undergoing and runs from March 20th, 21 to April 30. And the date for the third wave is still to be defined but likely will start in June and July. This is something that the research team still needs to discuss. And the results that we're going to present today, of course, are those about the baseline survey. The study population in the survey were Métis people, and that included both Métis citizens and non-Métis Nation of Alberta citizens who self-identified as Métis and that have lived in Alberta during the COVID-19 pandemic. The study participants should be also 16 years of age and older. However, the survey questionnaire applies to both respondents and their dependents that are aged less than 16 years of age. So for our recruitment strategy, we use a multimodal strategy that has been used by the Métis Nation of Alberta in the past for community consultations. And this work was led by members of the Métis Nation. So we use the newsletters that are distributed to citizens, the emailing list. We also use social media channels, and just for your information, the presence of Métis and the Métis Nation of Alberta in social media is amazing. For example, the web page in Facebook, it has over 100,000 followers, and on Twitter it's about 2,500 followers, and Instagram also has a presence, so this is fantastic. And another way to distribute, and let Métis people in Alberta know about the survey was using posters at the 6 regional offices across of the Métis Nation of Alberta across the province. So in all these cases, we have an electronic link that was used to provide individual consent and access the online questionnaire. So for the instrument that we used, this was developed by the research team in a close consultation with members of the Métis Nation of Alberta. And the survey questionnaire included key domains that are related with socio-demographic characteristics, the experiences with the COVID-19 pandemic, including the symptoms, experiences with testing, access to health services during the pandemic, and perceptions about vaccination. If you remember, by December, well, we were still in the woods regarding vaccines in the province. So it was more about the expectation of what would happen if a vaccine would be available. So I'm just mentioning this because this is going to be very interesting to compare the results with wave 2 now, in which we have active vaccination activities, and specifically, and Raegan will provide more information about that, how the Métis Nation of Alberta has led the first Métis vaccination clinic in the country. And it will be interesting to see how the people that respond to the survey incorporate that information now. So other domains were how the experiences and, the status of physical health, mental health, health behaviors during the pandemic, perceptions of social well-being and community support, experiences with racism and discrimination during the pandemic, financial challenges or the financial situation, and perceptions about the support that has been provided by federal, provincial governments and the MNA per se. So when we developed the questionnaire, we did a pilot testing for face validity with a group of 10 citizens of the Métis Nation prior to a wide distribution. We also tried to provide some facilitate access for individuals who experience barriers to survey completion related to their ability to read or write. So the MNA facilitated telephone completion of the interviews in English, French, and Cree languages. In terms of development of these surveys, I think I want to highlight how there were some members that phoned directly the MNA to make suggestions about how the survey can be improved, just spontaneously. And I believe this shows how strong the community is and the strong interest by the community, the Métis community, to better understand what's going on during the pandemic for the Métis people. So these contributions by Métis individuals that approach the MNA are fully acknowledged, and I think this is a good opportunity to thank the community for that active engagement. And we were able to modify also the survey, taking into account these perspectives. So in terms of process, we enter all survey responses were entered into a secure database that is held right now in a secure server at the University of Alberta. And the results that you will see today are result from a descriptive analysis, and we used a mean and standard deviation for data that is represented in numbers, and we use also proportions and percentages. So these are kind of the units that you're going to see in the next few slides. Very importantly, we gave careful consideration to protect the identity of respondents. So we provide this information in an aggregate way, and we also collapsed categories when the number of responses in any category was less than 10 individuals. And this is a standard practice for protecting the privacy of the responses of individuals. We have for the survey questions that were close-ended, meaning that is a yes or a no or complete this box. But we also had open-ended questions that were a unique opportunity to hear the voices of Métis people in the survey. So we always use this saying that we want always to provide the stories behind the numbers and making sure that the community perspective is absolutely reflected in the report and also in the interpretation of the findings. Also, we make our best efforts to comply with the consolidated criteria for strengthening reporting of health research involving Indigenous people, and this is a good practice in Indigenous research. The consider statement has been developed by Indigenous people and as a way of self-determination on how research about Indigenous people should be reported. So going to the results now, I think, Raegan, you might want to start.
Yeah. Thanks. So community response to this survey was a bit overwhelming, if I'm being honest. I really, truly do think it served to validate the need for this work. It didn't pop out of my brain. It didn't pop out of the MNA's brain. It came out of conversations with community who had questions, and we decided we needed to answer them. So 1,508 people responded with various levels of completion to our survey. Métis Albertans, including including those who self-identified and may not be registered citizens of the MNA, were invited to participate. And I think that's important to acknowledge. However, an overwhelming majority did actually identify as citizens of the Métis Nation. You'll see about 98.4%. And the mean age of response was roughly 46 years. And a majority of those respondents identified as female. So a majority of the respondents also indicated that they were in a relationship, while about 30% indicated that they were single at the time of survey completion. Of those that responded, I find this really amazing. 43% indicated that they had completed a college degree or university degree, with almost 10% completing a graduate or professional degree. 13% did pursue a trade certificate, with a third of the respondents indicating that high school was their highest level of education that they had attended at the time of the survey completion. And only about 1.4% of those who did respond indicated that elementary school was their highest level of completed education. We do know that socioeconomic status is an incredibly important determinant of health. And within those who responded, we do note the following household incomes, which you can read on the slide. And I just want to make sure that you note that these are household incomes, and it doesn't take into consideration any other calculations, such as the number of dependents, etc. So this is just a really preliminary descriptive presentation. So I just want to remind you of that. There's definitely room to unpack this further, because we do see household incomes that are less than $10,000 a year. And I want to go back to my original point where this is not because they are Métis. I'm very cautious in presenting this kind of data because it, could create a harmful narrative. So that is not the case. It's just a descriptive narration, and it does not reflect the fact that a person is Métis to have those numbers.
So when we look at where respondents live, we found that over half of respondents live in large cities. So it was also almost 56.9, 57%. And we have about 22.9 that were living in a small town, about 19% living in rural areas, and a very small proportion of respondents living in remote areas. And when we look at where participants in the survey lived in relationship to the different Métis Nation of Alberta regions, we found that most of them lived in the region 4, which has the kind of headquarters in Edmonton, and also in region 3 in Calgary. I think part of these results reflect, the fact that Métis have a big urban representation, and I think somehow these surveys reflect that reality as well. In terms of the households, and we can go to the next. Oh no, it's the same actually. Oh. Yeah. So yeah, we found that most of the respondents, so it was almost 90%, were living in a house, and I would say in a safe housing situation, in the sense that they were living in a home or an apartment that they own or that they were rented, with a small proportion, about 10%, living in somebody else, a member's or a friend's house, and with a very small proportion, 1.7, of individuals that live in, in other type of arrangements like surf coaching, or maybe living in shelters, and individuals that probably were in a more home insecure situation. When we look at the composition of the respondents' households, we found that in 69% of the respondents, they reported that there were about 2 to 4 adults living in the households, and 29% reported only one person living per household. So this is an important indication of how many Métis people in Alberta will live by themselves, right? And also we look at the households in which there were children living at home. And we also found that 69% reported that one child lived in their household, and 26% reported that they had between 2 and 4 children living in the household, with a small percentage of 3.8% having 5 or more children in the household. 43% of the respondents were parents or guardians of children aged less than 18 years, and 26 looks like these are young families. They were parents of or guardians of children that were aged less than 4. And as you know, probably the challenges of families that have small children during the pandemic are different. And that's also part of the things that we explored in our survey, how Métis families have coped with, having children at home, with the school closures, with all these disruptions in their life, and how the kinship ties and family ties and community ties that are so important within the Métis culture has been disrupted by the pandemic. So now we can move into the experiences with the COVID-19. So we asked about the respondents whether they have had, or if they previously had, any COVID-19 symptoms. And we found that 96% reported that they did not have any symptoms related with COVID-19. And 3% reported that they had COVID-19 but had already recovered. We found that 42% of respondents sought some kind of medical advice in relationship to symptoms or concerns that they have, or that they would like to have discussed about COVID-19. And there were different options for accessing this type of services. Most of the respondents, which is 15% of them, discussed potential symptoms and concerns using the Alberta Health Link phone line. They talk over the phone with health practitioners for about 9.3% of respondents, or they visited a walk-in clinic, which is 7.8%. And the proportion of individuals that try to use other resources like talking with indigenous healers, traditional healers, or visiting the emergency department or a pharmacy were less frequent options for the respondents. Then we look at their experiences in terms of testing and getting tested during the pandemic, and we found that near 54% tried to get tested for COVID-19, and of these, 6% reported a positive result, while 94% reported a negative or inconclusive report. And 0.8, a very small proportion, reported an admission to hospital because of COVID-19 symptoms. During the testing process, we found that 97% of respondents reported that they were treated in a respectful manner. But I have to say that for this, we have an open-ended question in which respondents had the opportunity to comment about that experience in their own words, and those are results that you will see probably, well, you will see in the following slides.
Yes, it's really important for me in my role to really understand the experiences of Métis Albertans. I kind of like to think of myself as a megaphone, and I serve to amplify those voices. So in this case, we really did want to understand a little bit more of the context around the COVID-19 testing, remembering that this was kind of back in the time before we had to worry about concerns like vaccination, because it wasn't available. What we were doing was contact tracing. So a quarter of those who responded indicated that they sought testing because they actually had symptoms congruent with COVID-19. 12% or almost 12% indicated it was because they had contact with somebody who had COVID. I find it interesting, almost 10% access testing simply because they were worried and they wanted peace of mind. I think that's very congruent with a lot of what I was seeing, on social media and in the media in general. And there were some folks, almost 10%, so 9%, that got tested because their school or work requested it. Now, I'm a strong believer, absolutely, that numbers contribute to a deeper understanding of experience. They are definitely important, but the numbers alone, as Maria alluded to, don't provide the full story. So to ensure that we could contextualize our domains, we provided open-ended questions where Métis Albertans were provided an opportunity to share whatever they felt we needed to hear. The responses were amazing. Some of them were heartbreaking. But it's the valuable part of this research that just, it contextualizes all the amazing descriptive data that Maria is sharing. For the open-ended questions, we conducted a thematic analysis to provide some of those contextual pieces related to the experience of the COVID-19 pandemic. And we identified broad themes and concepts that were grounded in the survey data. We use a First Nations mental wellness continuum and a Métis Nation holistic health and well-being framework as a critical aid and thinking aid during this process. And the frameworks do acknowledge the role of proximal and distal social determinants of health, including things like colonialism, systemic discrimination, and intergenerational trauma, which we know do shape and influence physical, mental, emotional, and spiritual well-being amongst Métis communities. So here I'm going to present just a sample of the rich data related to COVID-19 testing. And you can see from this small sample that community is providing solutions. So one of the first themes about COVID-19 testing and the experiences was one of mistreatment. So one participant said they felt like a cattle being herded through hordes and lines of sick people. The staff were cold, lacked compassion for how anxious I was feeling. Another participant said I felt rushed, like I was a number and not a person. We had a theme of poor organization at the testing sites. Someone commented that there weren't even disinfecting the chairs in between people. I truly felt that if I was ever going to get sick, this would be the place where it would happen. And some community members shared that they had issues with test results. So I never received a call with my results. I had to miss work and I waited. I finally had to make an appointment with my doctor in order to get the results.
So there were some challenges in accessing healthcare services during the COVID-19 pandemic, and mainly they were related with accessing their family doctors. But they also reported difficulties accessing dental care, specialized medical services, diagnostic testing, mental health services, and rehabilitation services. Those were areas in which it was really a challenge for Métis respondents to get help during the pandemic. Then, we have public health orders, and respondents we can see in this analysis that there was high levels of compliance with public health recommendations. So we can see that almost 96% report that they are washing their hands with soap and water. So everybody's being really, really good, very compliant. Raegan and I have different, we're still trying to understand if this is something, it's a real result or not. Is this responding to probably a desire to show that you're a good citizen or not? That you say, yes, I do all these things, or not. But I want to think that this is just showing, something that is happening, that after 1 year of being told to wash our hands and be careful with some of these measures, people are just taking this as part of their normal lives. Well, not normal, but their lives.
So just as this wave of the survey, this wave of the survey was distributed just as the first vaccines were being approved. And so to better understand how community viewed COVID vaccination, we asked if a COVID vaccine were available today, would you choose to be vaccinated, and how likely would that be? And almost 65% of our community responded that they would be willing to roll up their sleeves if it came out the day the survey was out. 26% indicated that they were not likely to be vaccinated with the current COVID vaccines. Again, if you just looked at the numbers, you have a really limited understanding of the why behind the choices that Métis Albertans are making. And it really does, from an action perspective, limit my ability to advocate for any sort of change programs, services, or policies. So when you look at the reasons, which I'm going to share, you can see that there are areas where Métis Albertans are identifying educational gaps and needs. There, the recognition of colonial injustices and traumas that have impacted Métis Albertans. So, vaccine safety was a common theme. I don't trust it. I'm usually 100% vaccine supportive, but not for this one. Too many questions, too many politics, and too many inconsistencies. Again, a sub-theme of vaccine safety, it was made too quickly. It's too new. Vaccines typically take years to make with tons of trials. This vaccine was manufactured and distributed way too quickly. I believe this vaccine has been rushed through. The mistrust of government, I'm willing to get it, but many of my Indigenous friends, particularly those with minimal education, are not willing to due to mistrust of government and previous programs that made Indigenous people guinea pigs. And then there was a call for more information. There's some talk amongst people that if Indigenous people get it, then it would be seen as testing. I think messaging that it is safe from side effects and how the vaccine would help our people. So I'll turn it over to Maria again. I'm always just amazed by the solutions that come out of community, right?
Yes, these comments are very rich, and it's not about complaining, it's about proposing creative solutions for the community. So I think that shows the resilience, wonderful resilience of Métis people in facing adversity. We have, as you could see, like 9 sections, and we are not able to present all these results in just a 40 minutes presentation. But the last result that we're going to present, and is kind of an invitation for the next outcomes that will be reported in the community report, is about how the overall quality of life has been affected as a result of the COVID-19 pandemic. And we found that 70% of respondents had the perception that their quality of life has been worsened. 23% felt that it remains the same, and we found a 6% that feels that it has gotten better. So it's an interesting distribution of responses. And as I said, we also have to complete the analysis of the open-ended questions and understand a little bit better the narratives around this perception of how, has changed or not quality of life during the pandemic.
Mm-hmm. I think it's very necessary, to end on a strong note. And I think highlighting that the lived experiences and perspectives of Métis Albertans is critical is a good way to do that. Priorities are not or should not be set by technical staff in a vacuum. At least that's not my principles, and that's definitely not the principles that we adhere to at the MNA. So without those who have graciously shared their stories and experiences, it would be left for others to determine those priorities. And let's be real, that hasn't worked out for Indigenous people in the past, and it doesn't work out in the present usually when other peoples are deciding what our priorities are. So when stories are shared, it gives Métis Albertans that voice, and it provides folks like me the context in which to advocate for and implement policies, programs, and services. So what the heck does that even mean? that last slide sounded like jargon, even to me. And so I feel the need to call that out when I'm giving a community presentation. So I think to clarify, I want to show you the power of Métis voices, the ways in which we truly do work to try to honor the voices of Métis Albertans. And based on the fact that we had testing experiences, the qualitative data that I just briefly highlighted for you, and it showed that we had solutions and room to improve, we actually applied those lessons to another area within COVID, the M&A vaccine clinic. And this is not a shameless plug for what I truly do believe should be a model for all future vaccine clinics. But what it actually is showing you is that it's a direct reflection of action that's grounded in community voice. Community voices contributed to the development of this clinic through their qualitative responses about vaccination, that need for education, that need to not feel, to feel safe, that need to know that we're being taken care of. And so because of Métis Albertans, we had that understanding, and I think we were able to target some of those concerns raised around testing within another program. So I think it's important to see how surveys and opportunities like this do lead to action. Far too often in community, we hear, people come in, they take our information and nothing comes from it. This is a tangible reflection that our work has led, your voice has led to the development of an amazing initiative. And this is just based on the very preliminary results that we shared with you today. So imagine what we can accomplish when we move forward. Maria.
In terms of the next steps, we are currently wrapping up the second wave of the survey. And with all these results, we are currently preparing a community report, very comprehensive, including the results of wave 1 in all the different categories that I mentioned to you. And then we have to plan the third wave of the survey. At the end, our goal is to provide a longitudinal analysis to understand the trajectories of health and well-being of Métis Albertans during the pandemic. This is not going to be the first pandemic, unfortunately, but beyond just providing descriptive data, the purpose of all this work is to inform action and to identify if there are groups within the Métis community that probably require more targeted interventions during the pandemic, specific support, listen to the Métis voices about what they want and in which ways they can be supported or they need to be supported during the pandemic. And I believe that this is descriptive research. We're providing a snapshot, like giving a picture of what is the situation, but very importantly, this research is supposed to be translated into action. So it's research that directly informs action to tackle the challenges of Métis people during pandemic times.
And before we get into my favorite part, which is the questions, I just want to acknowledge that myself and Maria and the team that we work with really do understand that there's a diversity of opinions and knowledge levels around COVID-19. So with that in mind, when you're asking questions, it is a safe space. Nathalie, Dr. Kermoal did present that. But I just want everybody to really reflect and recognize that while you may personally not have been deeply impacted by the virus itself, others who are attending this webinar may not be so fortunate. So just when, be cognizant of the space that you occupy when you're asking questions, just so that we can care for each other while we're doing the presentation. And with that, we'll say merci. I'll end my presentation and we can move to questions. Thank you so much.
Merci, Raegan and Maria, for this very informative and important presentation. So, Amanda, if you could relay the questions, we'll take a little bit of time for that, and then we'll move to our next presenters.
All right. The first is actually a comment coming from Carolyn, who says, action that is grounded in community voice. Awesome.
Thank you good job.
And then our first question comes from Cherie, who asks, I would be very interested to see the expanded thematic data. Will this be made available to the public?
Mm-hmm. So it will be made available to the community first. I'm making an assumption that, I don't want to make an assumption that you are or are not self-identified Métis. So just according to our kind of ethical principles, we want to make sure that we get that community report validated and out to our community first. And then those kinds of reports do live on the M&A website. And partners and affiliates like Rupert's Land are certainly welcome to share those things as well. So there will be both the descriptive quantitative, but also the thematic analysis made available in our community reports, for sure.
Okay, our second question comes from Paul Garrow, who asks, is there a plan to continue the M&A vaccination program with us middle-aged people? Ha ha.
Oh, Paul, you know what? The answer is yes. So we tentatively have a clinic scheduled for Calgary at the end of May, and that will be a Group D clinic. It will be a little bit smaller than the Edmonton clinic, and I'm currently working on getting one in the North Zone. Resources, obviously, Métis folks do not fall under, FNIB's non-insured health benefits. We don't have the same access. We acquire services through our health authority, so Alberta Health Services. And for those that have, been living under a rock, they're spread really thin. The rollout isn't going super great. I'll just call it out. I'm an honest person. So finding the staff to actually administer it in a good way is the trouble, Paul. So the answer is yes. I'm working on getting a second dose clinic for those in Edmonton. I'm always, anytime somebody says yes to me, I'm jumping on it because that's what community is asking for. It's not necessarily about access, or access to us isn't necessarily like, oh, there's a mass clinic. Access is about safety as well. And we had people driving from Grand Prairie to an Edmonton clinic, Lloydminster to an Edmonton clinic, just because it was done in a good way that was responsive to what came out of our qualitative data about COVID. So the answer is yes. There will be some more opportunities. Are there as many as I want there to be? No. Are there as many as community wants there to be? No, but I'm a megaphone. So every time I hear a comment like this, Paul, I take it right back and I squeak even louder. So.
Wonderful. Carol says, excellent information. And then we have Dr. Florence Glanfield, who says that I appreciated the Edmonton clinic so much. And I will echo that. I took my father to the Edmonton clinic and it was a very nice, warm and welcoming space. Amazing.
Thank you.
Do we have any other questions?
Maybe I could ask. I can ask one. So we are 1 year in the pandemic. And in hindsight, are people talking about what could have been done better? What do they say?
Yeah, I think internally at the M&A, we are talking about what could have been done better. But similar, and I try to live my life with compassion, kind of being at the forefront of my mind. Even when I'm speaking about things like government at any level, everybody's still in response mode. When we think we get a piece of slack, then we enter a new wave and then we go right back into response mode. So I truly don't think that there's been an adequate enough opportunity to unpack those lessons before having to then respond again. I can only speak to my experience as health director. I sit at many tables, urban Indigenous people's tables, and across the spectrum, not just COVID related, mental health, maternal child health, all of those tables where we are trying to unpack lessons, but the minute you get started, something else hits, right? So first it was, how do we make testing better? How do we make that website better? 811 is a nightmare. So you start talking about those things and then the vaccines got approved a month earlier, right? So in those moments, you didn't get to fully unpack all the lessons around one topic before moving to the other. And the reality is that it's taking everybody. So the collaboration actually has been fairly impressive, not perfect. I definitely will not say that, but the collaboration has been impressive, but it's the same people. And so we're spread pretty thin trying to not only learn and grow, but respond, because ultimately, community, it's great. They've been so patient with us, and we're responding to the best of our abilities in, I don't want to use the term unprecedented because we've had pandemics in the past, but this one's a doozy, right? So they've been patient with us as we try to unpack those lessons. But I really think that there's going to be a lot of things that happen after the fact, Natalie, because I truly everybody's just trying to put the focus on the people that actually have needs. And whether that's good practice, in my mind, no, because I'm very much a believer from my academic background that if you can't unpack those lessons, you'll keep making the same mistakes. But I also understand that it's situational. And so I hope that pieces like this, we will do a community report, and then we as a team will sit and try to unpack those lessons as well, and with the guidance of Dr. Ospina and the collaboration that we have, hopefully we'll be able to share lessons that are relevant to our Métis community and get those to the people that can help us make the change, and keep it very much, self-determined, right? This is what we experienced and this is what we need. And that's, I think, the goal going forward. Sorry to kind of ramble, but it's a complex topic.
Yeah, I would add to that, Raegan, that what this survey is doing is telling a dynamic story at different times during the pandemic. So our first wave is about, we are in the middle of this disaster. We are in wave 2, we're kind of seeing the light. That's the way, probably a general feeling with the vaccination for some people, right? And we will try to have wave 3 that's gonna probably tell a different story. I have the impression that the survey itself, and looking at the huge response, 1,500 people responding to a survey in any communities is big. Why such a high response rate? I think it's a reflection of the need of the people to have their voice heard in many ways. So yes, we're putting together numbers, but this is not only about putting numbers together. As I said before, this is numbers that will trigger action, but always keeping in mind all the narratives. I guess somebody asked this question about the thematic analysis, just to give you a little bit of background of that. For one open-ended question about the experiences around the testing, we have about 500 comments. We cannot ignore those stories. So part of the thematic analysis and the challenge that we have is how we can put together all these stories to give meaning of the numbers at different stages in the experience of pandemic. So we are a little bit of storytellers using numbers here.
Good question. Thanks, Natalie.
Thank you. So Amanda, do we have any other?
Yeah, just one final question from Hillary, who asks, will there be a Calgary clinic?
Working on it, Hillary. It's going to be smaller. So in Edmonton, we delivered 1,301 vaccines. So Calgary is going to be a little bit smaller, just based on Alberta Health Services capacity. So it's going to be roughly 300 doses. So it will be a little bit smaller, but I don't have confirmed details yet. So I'm working on it, going to be close to the end of May, and we'll disseminate that kind of information in the same way that we do these surveys, through email, our MNA website, and MNA social. So if you're not already dialed in there, check into albertamétis.com. Sorry.
Well, thank you very much to both of you for taking the time to come and talk to us. I think it was
my pleasure.
And needed, especially after a year of COVID. Thank you.